Well, fears are growing in Hong Kong of a second wave of coronavirus. The territory had been successful in containing the first outbreak, but new cases have spiked in recent days. On Friday, the territory reported a record jump in coronavirus cases as thousands returned home from overseas. Authorities fear the influx of people could lead to a community outbreak and paralyse the city's medical system. Hong Kong now has more than 270 confirmed coronavirus cases. Well, for more, I'm joined by Dr. Alfred Wong, a cardiologist in Hong Kong. Hi, Dr. Wong, thank you for joining me. A senior health official in Hong Kong has described the new cases as scary. How bad do you think things are likely to get there?
Well, I mean, we have survived the first wave of influx of patients. The first wave of patients came from mainland China, and we have been quite successful in containing that wave. We kept the number of patients of around 100. But in the last couple of days, we have huge waves of students and expats coming back from Europe and America. And many of these people are infected with this coronavirus. And we have seen a surge of patients in town, and we have just passed the number of 270. So yeah, it is scary. But we have been doing the good things. We have been doing the right things. We have been wearing masks. Almost everyone walking in the streets in Hong Kong are wearing masks. People have been very vigilant about their hand hygiene. And you could see people staying away from each other, maintaining social distance. And I think people will try their best to do the same thing. But this wave of infection is even bigger than the last one. So there is no telling whether we will survive this second wave.
People taking precautions, as you just mentioned there, but what other measures do you think need to be taken to stop the virus?
I think everyone is talking about hand hygiene. That is, of course, one of the most important things. And secondly, the practice here in Hong Kong is what we call universal masking. It's quite different from what you guys have been doing in Europe or in America. We have been wearing masks no matter we feel unwell or not. Because the thing about this virus is that it has a rather long incubation period, and the manifestation of being infected by this virus is of a very big variety, meaning that you can have almost no symptoms at all. So there's no telling whether you have already contracted the virus or not. So
there's a lot of sorry to interrupt you, but there's a lot of conjecture about whether or not the mask wearing is effective. In your opinion, is it effective?
It is. It is. If you look at the experience in Hong Kong or in Taiwan or in Macau, one of the common things that we have done is universal masking. Despite the close proximity of Hong Kong and Taiwan with mainland China, we have been having very small number of cases so far. So I think this is one of the proof that the universal masking is useful, is helpful. The only thing I can think of is that whether you have enough masks in your country. If you don't, then it is, of course, rational to reserve those resources to healthcare workers. But the thing is, if you do have enough masks, then universal masking, of course, is helpful.
Dr. Alfred Wong in Hong Kong, thanks so much for your insights.
Yeah.
Several Asian countries have introduced technology aimed at curbing the spread of the virus. Measures include bracelets and phone apps that report where users are and send them a text message if they stray too far from quarantine. South Korea, Taiwan, Singapore and China are all trialling the new technology.
Travellers arriving at the airport in Hong Kong are met by officials who issue them with electronic wristbands. The city says it has 20,000 of the bracelets. They must be worn for 2 weeks of compulsory quarantine. Returning resident Angela Fan is sceptical.
You download this app and then you have to walk around in your house and then to detect where, like, how big your house is. So as soon as you get out of the house, and then the government would get alert, and then the healthcare or the police would come catch you, and then it would be up to 6 months imprisonment.
Many of Hong Kong's confirmed cases caught the virus overseas or from close contacts with travellers. But only around a third of the wristbands issued so far have been activated.
One big problem is that they really didn't have a chance to test run the whole system before it goes out. I think that has nothing to do with the technology. It's a procedural handling problem at the airport. Huge number of people, a lot of confusion.
Some users question whether this surveillance system can work.
As I said, this wristband is supposed to be very tight in your arm. You're not supposed to be able to take it out, but then,
Authorities are warning returning residents and others arriving that sticking strictly to their quarantine is critical if Hong Kong is to avoid a second wave of infections.